Okay, let's be honest, we all have neck and back problems. It's just a part of life. Well, I swear by two things, yoga and a chiropractor. So it's time to get adjusted, you guys, with Dr. Connelly. A healthy spine is a healthy person, right?
It is. A lot of times patients, they have problems in their spine and it relates to other problems. Because if they're stiff or if they're achy or if they have pain, they tend not to exercise, or they may be sitting on the couch for regular periods of time and not doing the activities that keep them healthy. Back pain and also pain in general, you know, it's interesting, more people suffer from pain every year than diabetes, cancer, and heart disease combined. So pain is a very common problem, and most of the time it's not really dealt with appropriately. The most important thing is to find out what's causing the pain, because a lot of times patients come into my office and they don't have a cause of the pain. They just say, I hurt. Or maybe they come and they say, I saw a doctor and they said I have cephalgia. And cephalo means head, algia means ache, so it just basically means they have a headache. So the first step is always to determine what's causing the pain. And once we determine the cause, then we could determine the appropriate treatment.
Sometimes emotional issues or ailments that adjustments can help with.
Well, it helps the whole body function appropriately, and the body was made to function at 100%. It wasn't made to function at 80% or 20%. So anything you do to help the body to function is always going to be better off. About 50% of the patients I see are auto accident patients. Besides being a chiropractor, I also have a degree as an independent medical examiner. So I also work for insurance companies. So I do reviews and I do testify in court and do different things like that. The other 50% are usually sports injury or family practice. So I see a lot of those patients as well. We sit down and go over the cause of the pain. Is the pain coming from the disc, coming from the facet, coming from the muscle? There's actually grades of sprain strain injury that you have after a car accident. So we say is a grade 1, 2, 3, 4, 5 injury. Depending on that, then we give a treatment plan. Most patients at that particular point, you know, if it's a grade 1 through grade 3, we're going to be able to manage appropriately and everything's going to work out well. And we do the treatment for usually about 6 to 12 weeks.
Now, is there anything that we can do at home along with the adjustments that we get done with you that are going to kind of like help us heal better?
Definitely. In fact, that's sometimes the most problem that we have, are patients who don't listen to our directions, or maybe a friend told them to do something. So if they're able to stretch, if they're able to avoid injury, that really makes our job a lot easier. Some patients, they feel that they want to come once a month just because it feels good. Sometimes they want to come once a week. Other times they say that they just come whenever they feel that they have pain. So I always say, though, a strong spine is a healthy spine. So if we're able to teach them how to do home exercise and home activities, then long term they're going to be a lot better off. We do decompression traction, which that's for patients who have bulging or herniated disc. We have different types of traction and massage therapy to help to relax the muscles. We also have something called hydrotherapy, which is hot water therapy, and that basically relaxes the muscles through heat. So the heat massages the back and relaxes the muscles. We have electrical stimulation, which electrical stimulation blocks the nerve and also helps with muscle spasm as well. And of course the chiropractic adjustment, which helps with mobility and helps the body to function better. We actually now have access to the CAB Imaging Center, which is one of the best diagnostic imaging centers in Atlanta, and they have really good magnets as far as determining MRIs, so we could actually get better quality MRIs to see what's going on with patients. So it's really exciting. With the last 2 years, we now have access to the best imaging equipment in Atlanta.
When patients come to chiropractors, they try to adjust the patient, try to use natural things to get the patient healed well. Some of those patients occasionally need some medical, or pharmacological management. That is when they come to us to supplement that part of the treatment.
I've had patients that they were in their 90s and patients all the way down to 4 weeks old. So, it's something where, I've seen many different types of patients. In fact, my daughter not too long ago, she's 11 years old, and she had said, Daddy, what do they do if kids don't have dads as chiropractors? It's something where you get used to getting adjusted, and it is something where you forget sometimes how important it is. We have a website, it's painatlanta.com, or you could also reach us at 770-469-7330.
Thank you so much, Dr.
Well, thank you very
Connelly.
much.
And this is why I love my job, because I swear by chiropractors. So now I get to get a nice, great adjustment by Dr. Connelly.